All right. Hi, everyone. My name's Lauren Edline. I am a primary care provider at Upstate. I'm one of the frontline providers you've been hearing so much about. And I'm going to talk to you guys about a bunch of different things today. We're going to talk about holistic treatment for post-treatment Lyme disease syndrome. We're going to talk about some other things as well. But every time I teach, before I start, I like to do a quick acknowledgement that we are on Onondaga land, and we are doing this work today because of the sacrifices of people who were here before us. So with that, I am going to get started. I want to say a little bit about why there's an herbalist up here talking to you guys. I'm a registered herbalist with the American Herbalist Guild. I was an herbalist long before I was a primary care provider. I'm part of the integrative umbrella at Upstate. So I do see primary care patients in my practice in internal medicine. People come to see me for all sorts of reasons. Sometimes it's just for routine primary care, but more often than not, they're looking for a holistic primary care provider. But I also I wear a couple other hats at Upstate too. Oh, sorry, I tend to walk, so I'm going to try to not move. No, I'll just try to behave better. So I wear a couple other hats at Upstate too. I'm a plant medicine educator. Yes, that's something that Upstate has. I work with the medical school and with the Department of Family Medicine with residents and med students, and they follow with me during my clinic to learn about how to apply botanical medicines in their practice. The other thing that I now do is I'm doing consult work. So if someone has a primary care provider, but they want to see me for herbal medicine, holistic medicine, that is something that you can come to see me for. I wasn't actually doing that at all until actually Chris Paulino put it on my radar that some of his patients are asking about herbs and he doesn't know where to send them. So I actually do that work now because of Lyme disease. I never meant to be a Lyme specialist. When I was doing my herbal training, every herbalist that I worked with and learned from specialized in Lyme. And I thought at the time that it was like, this is not something that I'm super interested in, and never really spent a whole lot of time thinking about it. And now I realize why they all specialized in Lyme disease, because this is a really difficult disease to treat. We talked a lot about the kind of the way that we treat traditional Lyme, what we're supposed to do about it as providers, but a lot of times it's not enough. And the patients that I see, I'm going to talk a little bit about my patient population, but the patients I see in particular, it's never enough. I see a lot of post-treatment Lyme disease syndrome in my practice because most of the patients I am diagnosing with Lyme have had it for years before it's diagnosed. And those patients are tough to treat. And I give antibiotics, but more often than not, symptoms continue to linger. I think this kind of training and this kind of approach to medicine with something like Lyme is important because anything that we can do to increase our arsenal with something like this, a disease that's often chronic, a disease that often causes other things than just Lyme. We know now that Lyme can be an autoimmune trigger. It upregulates the immune system, and the longer you have it untreated, I found in my clinical experience, the more likely that is to occur. So anything that I can give you all to take back to your patients to help them, that's why I'm up here today. The other reason why I'm up here is because a lot of well-meaning providers are using herbs in their practice unsafely. And I take patients off their herbs just as often as I put them on. So I'm going to talk a lot about herbal safety today and when things are appropriate and when they're not. I am very, very proud to call myself a very boring herbalist. I tell my patients that if you saw it on TikTok, not only do I not know what it is, but I don't want to know what it is. So just want to tell you a little bit about myself. So I practice in a tradition called traditional Western herbalism. I was not trained in herbal medicine at a med school. I was not trained during my formal education. I was trained by community grassroots herbalists, and then I came to medicine later. So the tradition that I'm going to tell you about, these plants have been used safely in traditional communities for hundreds of years. So if you ask me about research, I will have some information to tell you. I will mostly tell you that currently herbal research isn't done very well. And it's not always done on the whole plant, which is problematic. So I am going to use some terminology that is part of the energetic system of traditional Western herbalism. And when I do, I will explain that. But I have a little information up here about where my type of herbal training comes from in my background. I will say, though, that this presentation is on more than just herbs because I am also a holistic nurse. So I have a board certification in holistic nursing, and this is something that I've had to apply directly to my Lyme patients. So I'm really glad that I got to talk after the patient panel because when I was here last year and again had this experience this year, I'm always extremely moved by the patient stories that come up at this summit. And I want to reiterate something that I think a lot of Lyme practitioners see in a lot of patients that have experienced that there is a large amount of trauma regarding the healthcare system that patients with Lyme or Lyme and their families go through. We spend a lot of time unpacking that trauma. The reason why I don't see people until 5, sometimes even 10 years into their Lyme saga is because other providers haven't looked at Lyme, haven't taken it seriously. I once had a patient walk into my office as a new patient, and the only reason why she had come to see me is that she wanted a psych referral because she had been told by so many other providers that all of her symptoms were in her head that she figured it was time to see a psychiatrist. We worked through kind of some of the things that was going on, and I eventually diagnosed her with Lyme disease, which was still positive on immunoblot. These are not the exceptions to my practice. This is the rule. So if you take one thing away from what I'm going to tell you is please listen to your patients. They may not have gone to med school, but they've lived whole lives in a body that we haven't lived in. Okay, so that is the patient population that I'm going to be speaking about today. I actually had somebody ask me in the break if some of the things I'm going to be talking about are applicable to patients with active infection too. None of the remedies that I'm going to be talking about are bad ideas for patients who have active Lyme, because everything we're going to talk about is symptom support, because usually that's all that I can do for people by the time they get to me. We do rounds of antibiotics, but primarily we're talking about long-term symptom support to give them the healthiest, most functional life that I can. Okay, I think that's all for this slide. Okay, so this is just a little slide about causes of post-treatment Lyme disease syndrome, which this is kind of a preaching to the choir slide. We all know, I think, that we don't really have the answer to that. There's theories that it's a chronic long-term illness. There's theories that it's immune activation that goes on for long periods of time. And there's also theories about long-term system damage. Luckily, everything I'm going to be talking about, it doesn't matter. It's all safe for whatever the case may be. Okay, so just defining some terms about holistic medicine. I know it says integrative medicine in your program, and that's what I'm going to be talking about today, but this is really a talk about holistic medicine because holistic medicine, our goal is to keep the patient at the center of wide circles of different layers of care that might include pharmaceuticals, it might include meditation, it might include supplements, it might include diet changes. The entire idea, though, is keeping that patient in the middle of it. And it doesn't matter. I did a talk once talking about the definition of holistic medicine in our community, and it doesn't matter if you've never touched a complementary therapy before. If you are a provider who is listening to patients, keeping their preferences at the center, and listening to their story, you're practicing holistic medicine. Okay. So we are going to be talking about non-medication options today for post-treatment Lyme disease because I do use pharmaceuticals frequently when I treat patients with post-treatment Lyme disease syndrome. I use a lot of pharmaceuticals, but there's other people talking about those options today. In an interest of keeping to my 30 minutes and not being repetitive, we're going to focus on the what I'd call the extra stuff. Okay, so these are the things we're going to be talking about today. And I'm going to be focusing now on how I build a protocol and what those protocols might look like. I also want to say that I don't practice concierge medicine. My new patient visits and my follow-ups aren't any longer and shorter than anybody else's. There are ways to make this work within the confines of primary care. And if you're having trouble figuring out what that might look like, I will be available to talk to. Okay, so this is how I'm building a protocol for my patients with post-treatment Lyme disease. So we focus on immune modulation. We focus on symptom support. So that's what I'd call the palliative measures, things that are going to help them live a functional life over time. And then resilience building, which is a fancy way of saying making sure that their bodies are strong enough and rested enough to actually live a life worth living. You'll notice that none of this is about actual disease treatment. So I'm not giving herbs to kill Lyme disease. Sometimes I will do that alongside antibiotics in particular cases, but this is all about what happens afterwards. Okay. So with the immune modulation piece, my goal is to help modulate the immune system when there's evidence of upregulation from either persistent infection or chronic activation. So that's kind of the theory that we're working from. Okay, I don't need to know the answer about which one, maybe a little bit of both, but that's what we're working towards. We're trying to help the immune system modulate and downregulate a little bit, because as you heard from a lot of our patient panels, and as I see in my practice, these patients, when they get sick or when they go through a stressful event or they get a bad night's sleep, it hits a lot harder. And some of that, from what I've seen, is because of chronic immune activation. So the first thing we always talk about, and this might seem basic, is trigger avoidance. So these are things that are commonly seen as triggers for inflammation: stress, sickness, travel, lack of sleep, food, environmental. These are all going to look different for different patients. I always ask patients to keep a symptom diary. Keep track of when your symptoms are coming up. Is it around certain foods? Is it around certain family members? That is also something that comes up a lot. But actually having them get to know their own experience, this idea of empowering patients to be an active participant in their own health is something that's often new for people. They've never been asked to keep track of their experience before, to write things down, to send me a message if they find out something new because I'm interested in it. So this can be really not only interesting for me, but it come with a lot of revelations for patients that they may not have been aware of before, and get them closer to being an active participant in their healthcare. So we all know we can't avoid triggers completely. So we also talk about different things that we can do to troubleshoot when triggers present themselves. So this might be holistic therapies, medications, and rest days. I don't think we always talk enough about the importance of rest during things like Lyme, things like COVID. I see a lot of long COVID in my clinic too. And a lot of times just identifying where those trouble areas are. And then that kind of helps us formulate a plan for when a trigger comes up or when a flare occurs. Okay. So one thing we do talk a lot about is diet. We've talked a little bit, different providers today have talked a little bit about compliance. This is one area where I do see a lot of difficulty with that. Patients come to me and they're all 100% on board with doing things holistically. That's why they've come to me. That's why they found me. But then one thing that you do need to educate your patients about is that this way of doing things is work. It's time consuming, it goes really slow, and it takes a lot of effort. But we do talk about doing an anti-inflammatory diet, which is also called the AIP diet. So these are working to cut down or limit or eliminate things that are found to be inflammatory. So a lot of times this can include things like gluten, foods that are high in histamine, coffee, unstable oils, and dairy. It's been traditionally used for autoimmune diseases, but I have found it to be useful in my patients with post-treatment Lyme, long COVID, and I have a massive population of patients with Ehlers-Danlos syndrome that I treat, and their MCAS, their mast cell activation issues, also responds well to this diet. So how to implement this? Patients need help. We don't have a lot of time to spend going over huge dietary protocols with patients, but not every patient's insurance is going to cover a nutrition consult, something I found out really early on in my career. So anything that we can do to give them information to take home, empower them to make these changes, and then set a follow-up plan. So a lot of things are available online. In Epic, I have a smart phrase with links and some basic steps to get started on dietary protocols so that patients can implement this stuff with a very clear follow-up communication plan with me. And also just very widely available in commerce is the Whole30. It kind of mimics the AIP diet plan. It's very accessible. None of these things are meant to be done long-term. They are, I call them a home science experiment. And I tell people, let's do it for science. Let's figure out where the problem areas are for you. So after about 4 weeks of doing one of these diets, we work on a reintroduction period. And it can be implemented without a dietitian, just with a little self-education from yourselves as providers. These are things that patients can do at home. They're free. They don't require going out and buying any supplements, going on any medications, and it's a really good way to practice root cause medicine. Okay. Some other things we talk about with immune modulation are the role of antioxidants, and we do this primarily through diet if people can. There are really expensive supplements out there on the market that you can buy to supplement antioxidants, things like CoQ10, glutathione. However, I tell my patients that if they could just work in half a cup of blueberries a day, they're probably going to be in good shape. And that's much more financially accessible and a lot more delicious than taking huge supplements every day. I'm not a huge supplement person. So antioxidants can help protect the tissues from ongoing oxidative stress, including ongoing immune response. I tell people eat the rainbow. I don't know where, I think I heard that in my integrative training years ago, but just eating a wide variety of fruits and vegetables, especially foods that are blood colored. I always tell my patients if it's the color of blood, it's going to protect your blood. So I use antioxidant protocols for my patients with diabetes quite often too. But there are some really easy, affordable, cheap dietary starting points for getting your patients more antioxidants without having to break their budget. Okay. Somebody, I think yesterday, it might have been Dr. Fallon, mentioned the role of probiotics. So this is another thing that's this emerging research on probiotics and immune activation is really fascinating. And I've been following that for quite a few years now. But the role of particularly lactobacilli and bifidobacterium in modulating T regulatory cells and working with helping to calm the immune system over time. I always tell people that it should be obtained through food if possible. Not everybody can tolerate dairy, especially since I probably just told them to stop eating dairy for a little while, and not everybody likes sauerkraut. So that can cause some issues there. I do have, brands that I often recommend if people have to take a capsule, but the types and the variety of species you're going to find in your food are always going to be a better match for your gut than something that you have obtained through taking a pill. If people are taking probiotics as a pill, they should be sure to supplement with prebiotics at the same time. Prebiotics are just a fancy way of saying food for your bacteria. But you can also do this with your diet using inulin-rich food sources. Those are starchy vegetables and herbs. In my tradition, we use turmeric and ginger a lot for that. I'm going to talk a lot today about mushroom medicine. I'm an herbalist, but I find that I use mushrooms more often recently than I do herbs. I use a lot of reishi. Reishi has some really amazing research behind it. If you are more of a research-oriented person, which I think is most of you, it's been found to have some immunoregulatory qualities. And then chaga is a very, very potent antioxidant. If you are going to use chaga, please make sure it's sustainably harvested or cultivated because it is endangered. But both of these mushrooms are great choices for folks that are showing signs of chronic immune activation. A little thing about mushroom medicine, there are a lot of different ways that you can buy it. If you go to Wegmans, for example, there's some brands where you can buy reishi in a little dropper bottle. Okay. So you can also buy it as capsules. You can also buy it as powders. What I will say is that mushrooms have to be formulated a certain way in order to access the polysaccharides where most of the medicine is. And because of their very tough cell walls, you're really only going to get that if those cell walls are broken and then the entire mushroom is ingested, which means it really needs to be obtained through a pill or, sorry, a capsule or a powder. The beta glucans stay pretty locked in the actual mushroom, even if you double boil it a couple times. So I really advise against providers and patients using liquid mushrooms, although you can buy them widely in commerce. So if someone comes to you and they say, I've been taking reishi, and they hold up this little bottle and they say it's not working, that may be why. So if you are going to start somebody on reishi powder, you want to aim for about 30% beta glucans. That's about as good as we can get. That's how tight these compounds are locked up in that mushroom. And for chaga, you need to aim for about 10% a day. And it'll say that on the bottle. We're going to talk about brands at the end, because if just about brands that I might recommend you use with patients. So there's also herbal medicines that we can use to help chill the immune system a little bit. These are herbs that in the energetic system we would classify as cooling, meaning that they help reduce heat. Inflammation, whether it's long-term or acute, is classified in our system as a heat response. So, but they're also stimulating because we want these herbs to cool down some of the inflammation, but we don't want to limit the body's ability to do what it needs to do if you do get COVID or the flu. So, and they're also herbs that really like to spend time in the immune system. So some examples I have listed here are echinacea, cat's claw, which is also used in a lot of Lyme protocols, like the Buhner protocol, which is a very, very popular acute Lyme protocol, utilizes cat's claw. I have actually found cat's claw to be more useful long-term than in the acute phase. Baikal skullcap, which is an Asian version of the skullcap that is native to North America, which I also use for nervous system regulation. Astragalus and Boswellia, which has a great affinity for joint-related inflammation. So this is kind of what I just said. I have a bad habit of saying my slides before they happen. But herbs that are able to cool and stimulate is usually the combination of actions that we want out of a given plant. And this differs from herbs that often get used for very acute inflammation, like turmeric, which I think we all know about turmeric. Patients come in, they've been on like these massively high doses of turmeric for the past 20 years, and they wonder why they don't feel good. So those herbs are really great for acute cases, but they also have, because they're so anti-inflammatory, they also have an ability to kind of shut down the immune response overall. They kind of, I hate comparing plants to pills, but they do work at high doses, kind of like, stronger anti-inflammatory medications. Okay, so dosing. So if you are going to start some of these plants, how do you want to start them? We always start low and go slow. Any herbs that I use that either activate or modulate the immune system tend to be in the stronger category. We're going to talk about gentle herbs in a little bit, but these ones tend to be pretty strong. So echinacea and astragalus can usually be started higher. So echinacea and astragalus are part of our adaptogenic herbs. They help the immune system adapt to stress. They can be used pretty safely in larger doses over long periods of time, where herbs like cat's claw, baikal, and boswellia should really be started low, because these are the ones that if someone's going to have a little bit of a reaction, it might be to these. Also, I'm a big advocate in my practice in general of not over medicating, and that applies to herbal medicine too. Okay. So there's also, this is an herbal safety point. They're kind of scattered throughout, and then we'll talk about some extra ones at the end. There are some herbs that are really inappropriate for people with long-term inflammatory issues to be taking, which include autoimmune disease, post-treatment Lyme disease syndrome, and some other things. And they're always my patients who are taking elderberry every day. So I have a lot of conversations with patients who we know their immune system is a little touchy about stopping their habit of taking elderberry every single day through cold, flu, COVID symptom or season. Elderberry has a pretty stimulating effect on the immune system. These are not patients that I want to have overly stimulated for half of the year. So we talk about other ways to kind of head off cold and flu, work with some immune things like echinacea that can be more helpful and safe on a daily basis. Turkey tail mushroom and maitake, I see these a lot in my practice. You guys might not have patients taking these. I have a lot of patients that do. So these are other herbs that I will take people off of if they also have a history of an inflammatory condition. Andrographis is a great acute herb that can help with especially GI symptoms and GI infections. However, it's not an herb that I would recommend for daily long-term use for the same reason. Okay. So we're going to talk about symptom support now. I had to pick three. This talk could very easily go on for a really long time, and I'm really long-winded. So I'm trying to kind of cherry pick the things that I see come up the most in my practice as far as my post-treatment Lyme patients go. So we're going to talk about cognitive symptoms, we're going to talk about pain, and we're going to talk about dysautonomia. And I'm going to try to go through these as quick as I can because I know lunch is here. So cognitive symptoms are extremely common in post-treatment Lyme. I think the patient panel attested to that, but it's extremely common for there to be problems with inattention, memory, fatigue, brain fog, and that's just hitting the surface of the cognitive stuff that I have seen happen. So rest is at the top of my list. Sometimes the best thing that I can do for a patient that comes through my door with post-treatment Lyme is fill out FMLA paperwork. Sometimes that's it. Sometimes it's just giving validation to them and their employer that there's going to be times that they can't do this, that they are going to need to be home. Not only is that an extremely validating thing to do for your patients, but it will come up, and no one should be losing their jobs over a chronic disease. So this can also be helping them find ways to increase their bucket, so to speak. Sorry, I'm drifting away from the mic again. And helping them to find activities that are energy restorative. So these might be things like yoga, breath work, meditation, watching Netflix on the couch, spending time with their children, especially spending time away from their children, but having them part of that conversation of what fills your energy bucket and how can we rope in the support of family members and trusted loved ones to help those days happen more often for you. Something that I don't think also gets talked about is that having to rest more can cause a mental health crisis for some patients. There are patients who are very type A, who are used to going at 110%, and having all of a sudden a condition where they can't be that person is extremely traumatic. And offering them ways that they can still do the things that they love or get as close to it as possible, and just helping them reformulate how that might look for them, giving them some reassurance that there are ways to do this long term, encouraging them to work with mental health providers, but having some recognition that just telling people that they need to rest can also be very triggering for some folks. So these are some of my favorite herbs for cognitive support. They include rosemary, holy basil, which is a Ayurvedic herb from India that's also called tulsi, ginkgo, and bacopa. Ginkgo is very, very widely known in the kind of herbal cognitive decline dementia community. We use it a lot for that reason. These are all really, really safe. However, I will say that rosemary is extremely heating and very stimulating. So if you have someone who's already kind of running on the anxious side, rosemary can aggravate that sometimes. So you might want to start that lower. But all of these herbs are things that are going to increase cerebral perfusion and blood flow to the brain. So that is how they work. They are circulatory stimulants. So, and they really like to stimulate blood flow to the brain. This is also a list of herbs that I use for ADHD when someone wants to supplement their medications. So they can be used primarily as tincture. So we're using these herbs as liquid extract primarily mixed with water or juice. But some people really like to drink Tulsi tea. There's whole brands just dedicated to Tulsi tea because it tastes really nice. And the act of drinking tea can be very relaxing and supportive for some people. Not me, I hate tea, I hate drinking it. But a lot of my patients, it doesn't matter what kind of tea you give them, they're gonna feel better when they sit down and drink a cup of tea. Okay. So just talking about mushrooms again, lion's mane is all over social media right now. It's a very big deal because of mushroom coffees and all these different mushroom supplements people can take now. But I've been using lion's mane for a really long time for cognitive support. And we can use that for neuropathic pain and paresthesias as well, which we'll get into when I get to that section. But here we're talking about general cognitive support, helping with mental clarity. So this is one of my favorite brain fog remedies. And then if there's some energy and fatigue on top of that, I will often choose cordyceps mushroom, which is an adaptogen, which I think my next slide is on adaptogens. And these are just the dosages listed for you. So if you're going out and trying to recommend how much one of your patients should be taking of those are the dosages that you want to go for them to be therapeutically helpful. Okay. So adaptogens, I always throw a slide in here about them because if you have a patient who has been taking herbs for Lyme disease, I would bet money that at some point they've been put on an herbal adaptogen. So adaptogens are very, very, very popular herbs. So if you go buy a Monster energy drink, it's going to have ginseng in it. So ginseng is an adaptogenic herb. These are herbs that found their way into popular use being marketed as working through the adrenals to minimize stress response and the perception of stress in the body. The problem is that they're also performance enhancing. So they get used as herbal caffeine and the wrong people end up taking them. You know, herbalists will say, oh, you're sleeping 3 hours a night and you have 3 jobs and you're burnt out and you have no energy, take an adaptogen. It would be the same advice to my ears as telling that person that the solution to their problem is drinking more coffee during the day. So there's some ways to misuse these. However, there are also really good reasons to use these, and a lot of them are my post-treatment Lyme patients. These are herbs like every ginseng. There's a lot of different ones. There's Panax from Asia, American ginseng here in the US, rhodiola, and cordyceps mushroom. They're also in all of the herbal products that you see on social media and TikTok as well. Oh, maybe I don't have a slide about that. So when to use these are the herbs that I go for when patients are sleeping 9+ hours a day and they still can't wake up. So my patients that are sleeping all of the time, they're like, I'm doing all of the things, I'm sleeping, I'm rested, I don't feel stressed out, but I don't have energy. That's one of the most common complaints I see with post-treatment Lyme is the tanking of the energy reserve. Then in the short term, these herbs can be really useful because it will help people with their get up and go a little bit. There's a lot of medications that will do that for us also. And my use of these herbs is not just Lyme related. I use them for my long COVID patients and my autoimmune patients as well. But that is a safe, sensible use of these, but I still only use them in the short term because research does show that over time, chronic use of these herbs can actually deplete the energy reserve. So I do want to talk about the ways that we can support long-term joint pain. Like I said, my patients, I give them doxycycline. They might have had Lyme for 5 years at this point, and the myalgias and the pains in nerves and joints take a long time to get better. So a lot of times we're just aiming for functional. So we always talk about not discluding the importance of functional therapies, whether that's physical therapy, acupuncture. A lot of times, this is lessons I learned from treating patients with Ehlers-Danlos. One of our goals, anytime there is there is pain in the joints that comes from an inflammatory process, we're working on small muscle and targeted joint support work with this kind of thing. So that might be through physical therapy, something like Pilates, but any muscles of the body that help support the joint, that's where we focus a lot of the work, and that's where I see a lot of improvement. I have PTs that I work with at Upstate and outside of Upstate that work with me on the treatment of these patients in particular. And we're always looking to try to find ways to give the joints a break a little bit, especially in patients who already have arthritis that's not related to Lyme. On top of a post-Lyme process, we're trying to strengthen their body as much as possible. And then talking, if when appropriate, about weight management and anything we can do to help promote mobility and movement. So herbal protocols for joint support, that's turmeric up there. I only use turmeric as needed, and I only use it in circumstances where we can't find other things. So turmeric does have the ability to mimic an NSAID in some of its side effects. It's also extremely heating and extremely drying. So if you have someone that's struggling with energy reserve, throwing a lot of turmeric at them, it might aggravate a lot of that. So I use Solomon seal as a baseline tropho-restorative. A tropho-restorative is a word for a plant that just offers overall system support. So we've been using Solomon seal for years as a way to offer overall joint support. I use it for every joint problem that comes through my door, and it usually helps. You just have to give it time. And then other things that are part of my joint support protocol is teasel root, which helps with muscle and connective tissue injuries, so sprains, tears, rips, pulls. Mullein root, which helps with joint alignment, and boswellia for inflammation in the joints for tissue integrity. So this can be taken individually or it can be blended into a formula. I do have companies that I work with that will custom blend for my patients. So, and then another thing I just added at the bottom, nettle and horsetail for trace minerals. A lot of people, if they go out and buy something over the counter that says it's an herbal remedy for joint pain, it probably has horsetail in it. So horsetail grows as a weed all over. It's from the dinosaur era. It looks kind of like a dinosaur plant. It is really high in silica and other trace minerals, but it's also a pretty potent diuretic. So warn patients, if they bring in a bottle and they say, my joints hurt, can I please take this for post-treatment Lyme disease? And you see horsetail in it, and they're also a patient that's struggling with dysautonomia or hypotension, they should not be taking that. So that's another just little safety warning. I actually don't really put people on these at all, but they have found their way into a lot of joint support formulas, and they're not always appropriate for patients struggling with post-Lyme. Okay. So talk here about some neurogenic symptoms, interventions for nerve pain, paresthesias, loss of nerve function. See a lot of neuropathy after Lyme disease. And then I also encourage functional therapies here, again, acupuncture, PT, and I have a lot of patients that benefit from craniosacral therapy as well. So some things that we can do for nerve support, I usually try people on alpha lipoic acid, 600 milligrams a day, and magnesium, either oxide or glycinate, 400 milligrams BID. If they decide to start taking glycinate because oxide isn't working for them and it's making them really sleepy, they can change that so that they're taking more in the evening and less during the day. But most of my patients who are struggling with this sort of pain don't sleep. So sometimes that can be actually an added benefit. And then we can also add lion's mane here for nerve support. Other herbs for nerve support are St. John's wort. So we all think of St. John's wort as like an herb for depression, but it's a nervous system remedy. In herbal medicine, we consider psychiatric changes in the nervous system to be part of the nervous system overall. So St. John's wort is an overall support for the nerves in general. And if you have patients that can't take St. John's wort internally, which we're going to talk about in a later slide, you can use it externally. It'll work great. I use it for radiation pain when patients are on chemo for breast cancer, post-mastectomy and radiation pain topically. It's super safe, works really well. Prickly ash, this is especially indicated for that lightning bolt pain that can happen with certain types of neuropathy. I really like prickly ash. It tastes terrible. So if that's something that you want to work with people on, make sure that they're diluting it somehow. And then milky oats, this is the top of the oat plant, the regular oat plant that we all eat for breakfast. It's a great nutritional support, but if you catch the top of that plant during the milky phase, we use it as a nervous system remedy. I use it over long periods of time. It takes a long time to work, but I use it anytime that there's degeneration in the nerves. It's always part of my supportive care for MS, and it's always part of my supportive care for Lyme disease. So I'm going to talk a little bit about dysautonomia. Also, you'll see there's a QR code at the end of my lecture today because I knew I wasn't going to have enough time to talk about it. I have a case study on post-Lyme treatment that I'm going to share with you guys, and it focuses on post-Lyme dysautonomia. So if you click that QR code, you're going to hear a lot of these remedies come up. These are the functional interventions that we always tell people what to do for dysautonomia. We all know this. This is still advice I give people, but sometimes I feel like that's where the conversation ends. There's also medications we use. There's medications I use. I have medications that I always have in the back of my head of like, this is where we're going to start. But a lot of times we need extra things for this. And I have also found that a lot of the remedies, the pharmaceutical remedies we use for dysautonomia can cause their own problems. So herbal support for blood pressure, I only use licorice if medications have failed because I don't think that licorice is a super, super safe herb to use for blood pressure reasons because it is so contraindicated in people with hypertension. And a lot of times what I'll see in my practice is patients that had like borderline hypertension and then they got, and then like Lyme disease happened and now their blood pressure is sitting lower than it did before. And I don't want to aggravate that. But if you are going to use licorice for blood pressure to support blood pressure, so licorice is going to upregulate blood pressure. It works through the kidneys to do that. 30 drops twice a day to start with that. If that is something you're interested in doing, my contact information is here. Please let me know. Licorice is one of those things that really should be started for blood pressure reasons by an experienced practitioner because it can cause so many issues. So herbal support for heart rate regulation. I like hawthorn. Hawthorn is in the rose family. I like a blend of the berry, leaf, and flower. I have great success for hawthorn and hypertension. I have case study after case study after case study of people being able to get off their blood pressure medications using hawthorn. But it's also really wonderful for heart rate dysregulation of any kind. It's overall symptom support for the heart. The only thing that I will say about hawthorn is it will sometimes potentiate the action of beta blockers. So I tell patients that if they're already on a beta blocker, the good news is we might be able to back it down a little bit, but they need to be aware that they might have symptoms of hypotension and low heart rate using both of them together. So I also use lemon balm, motherwort, and skullcap. All of these patients are considered cooling members of the mint family. The mint family really likes the heart and the nerve, so it helps us with that neurocardiac regulation of the system. It can also help. They're also remedies that we use for anxiety. So I also like to add some vagus nerve support function when I'm treating dysautonomia. Passion flower and wood betony are really great ways to do that. I also use a lot of that with my long COVID patients as well who are struggling with dysautonomia post-COVID. I think this is just my safety note about nettle and horsetail again. So I'm going to speed past this one for you. Okay, so I want to end with some comments about resilience building. So these patients are depleted. They're not sleeping. Sometimes they have trouble eating. They are in kind of a phase of functional burnout. We heard that a lot from the patient panel, especially when Julie shared her story. That's my bread and butter. So patients that are dealing with that level of inability to function, that's where I spend most of my day. So we're talking about all of these things as well. So how can we better manage stress, identify triggers, get you more rested, maximizing your support system so all of these things can happen? I have a toddler. You can tell me to rest all you want, and it's not going to happen unless somebody offers me support to do that. So bringing support systems into these conversations is really important, and being aware of how realistic is the advice that you're giving someone. That's part of how we change access to healthcare into actual change, is being aware that just being in the office and having somebody there doesn't mean that they can do all of the things you're asking them to do. So screening for and treating comorbid conditions, sometimes this is kind of taking that pause of like, is this Lyme, or is there something else going on in addition to Lyme that either new or we missed? Also, just managing chronic conditions like diabetes and hypertension and asthma and any other thing that might worsen the symptoms that they're having related to Lyme. So not forgetting that everything in the body is working together. Prioritizing mental health. The mental health of my patients that are dealing with post-treatment Lyme disease is struggling usually for two reasons. One, they've been so traumatized by the healthcare system that it's hard for them to trust what I'm saying. The other side of that is that they're in such a state of lack of function that they can't get themselves to a point where they can prioritize their mental health. So what can I do to make that easier? The Lyme support group is something that I offer up a lot. And then setting and resetting expectations. This one's tough. I am realistic with patients that the stuff that they're dealing with is hard and it's difficult, and I don't have a silver bullet solution for any of it. But especially when I'm seeing someone just for Lyme, and they've been dealing with this for a long time. Oftentimes they see me as the silver bullet, and we have to have a conversation about that a lot of the things that we're going to be doing are palliative, but we're going to do the best that we can to give them the most functional life possible. So these are some herbs that I have found useful for that end. So I was trained, anytime you have an herbalist, we're going to up here talking, we're going to talk about liver support. It's just something we were all taught. But being able to support the things in our body that help us detoxify. I know detox is kind of like a bad word. It is even to me, but being able to decrease that load, that workload on the body. We do this with dandelion, milk thistle, and yellow dock. These are also really great herbs for digestive issues in addition, which I'm not going to talk a lot about today, but they also serve a dual purpose there. Again, nutritive tonics, herbs that offer just overall symptom support for the organs and the systems that tend to suffer during processes like post-Lyme. Hawthorn for the heart. I like burdock root as a nutrition source. It's also really high in inulin, high in fiber, and it also supports the eliminatory pathways, especially the skin and the kidneys. Milky oats I use for the nervous system, and Solomon seal for the joints. So if you come to me with post-treatment Lyme, you're probably going to leave with all of these. And then milder adaptogens for long-term use. These are ones that I do recommend that people can use over a longer period of time if they're really struggling with the ability to function enough to start doing the things. We talk about Maslow's hierarchy of needs a lot in my office, and one thing that I find is that if people are in large amounts of pain, they're tired, they're not sleeping, they can't do the other stuff that they want to do with me until we address that. So sometimes we will use these herbs in particular to get people to the place they want to be in order to make the changes that they want to make. So just some safety information before we finish up here. Some of these I went through already. The top one, ginseng, these are the 4 Gs, and I mentioned all of them during this lecture. Ginseng, ginkgo, garlic, and ginger. Those are the 4 herbs that have potent blood thinning properties. So if you have patients that are on blood thinners, they should not be taking these. They will potentiate the action of their blood thinners. If you have someone on the opposite side of the spectrum who is at high risk for clotting, these herbs can dislodge a clot. So please don't give these herbs internally to patients that are on either side of that spectrum. Talked about hawthorn, St. John's wort can be used externally on patients with who are taking SSRIs and SNRIs. It can still be used safe topically. These are some plugs for some of the books that helped me. So if you're looking for further resources on some of these things, I'm not going to spend a lot of time on this slide, but it will be in the recordings. These are brands I trust. Most of what patients come to me with from the internet is garbage. So we talk a lot about what brands to offer people. I really like Real Mushrooms right now as a brand, but I also use Host Defense. Paul Stamets is a world-renowned mycologist, and his brand is pretty widely available in commerce. Big difference with him, though, is that he focuses on using the mycelium instead of the fruiting body, and there's some controversy about whether that's actually more effective, still just as safe. Liquid extracts, Herb Farm with a PH, very, very, very widely available brand. There's an Herb Farm stand at every single Wegmans in our town, and they have some of my favorite blends there, including the Hawthorne blend that I use because they use all 3 parts of the plant. But for things that I can't find through Herb Farm, I have herbalists and small batch herbal product makers that I like to use their formulas because I know them. Woodland Essence up in the Adirondacks is run by Kate Gilday, who's a world-renowned herbalist. Red Moon in Michigan and Jeans Greens is our neighbor in Albany, and they're a great choice, not just for liquid extracts, but for dry herbs. There's also a couple other dry herb sources, Frontier's really easy to get online, and Blue Moon Apothecary is over in Liverpool, and they have organic dry versions of everything we've been talking about today. This is the scan if you want for the case study, which I don't have time to talk about today, but that is a case study that's available to you from one of my post-treatment Lyme patients with dysautonomia and how we treated that. I think the next slide just says thank you, and I don't want to leave it past this one, so I am going to end there, but have time for questions.
Are there questions for her?
Okay, I'm going to take 2 on Zoom and then we'll go over there.
Yes, 2. First, are your services covered by insurance?
Yes.
Perfect. Next, how do you measure degree of inflammation? Are there specific lab tests that are helpful?
I have not found specific lab tests helpful, although I will say, and this has been reiterated by every other provider that's been up here, if there's something weird going on and it seems like it's out of character for how someone's Lyme course has been going, test for other things. Make sure that it's not something else, that there's not something new that's come up. You follow their story, make sure that you're getting a comprehensive history, because it could be that there is, I talk about Lyme as an autoimmune trigger, and I've also seen that happen. So I will, when appropriate, I'm not a provider that's in favor of doing inflammatory markers for no reason. But if I do think there's a reason, I will measure them, although I don't usually see massive changes in inflammatory markers with this because it is so low grade.
And then one more just popped up. As you began your presentation, the emphasis seemed to be on a healthy diet to get the necessary nutrients for symptom support. Sorry. Do you consider herbals as food or strictly as supplements to a healthy diet? And it seems that supplements can run into a lot of money, cost a lot of money.
Yeah, so I consider them separate. The USDA considers them to be the same. So I think that, like, from a marketing perspective and the way that you actually buy and sell herbs, they can seem very similar. But I consider diet to be more foundational than herbs. So I put herbs very much in the same category as medication, which it's a therapeutic intervention. It's not a lifestyle intervention.
Cool. Also, one quick note, the QR code seems to have been disabled for some reason. We're not sure
Awesome.
why.
I can email the link to the folks at the summit and get that out to you guys.
Great. Question over here. Not usually, no.
Thing?
Here you go.
Thank you very much. I have 2 questions. If a patient comes to a primary care provider and asks for their opinion regarding a person who's providing integrative holistic are there any red flags that you would want the primary care provider to be aware of in evaluating the competency of safety of that provider?
So let me just make sure I have this right. So if you're sitting in a primary care office and you have a patient who comes to you and they're seeing a different practitioner for holistic medicine, is that what you're,
Yes.
Okay.
Yes.
um,
So they bring up the website and say, oh, this person does chelation. I'm gonna
Yeah.
do that.
yeah, I get that a lot.
Okay.
I am, it probably doesn't seem it from my presentation today, but I am at my most base a skeptic. And I think that's a really hard thing to judge. What I do is I gauge for safety. So if they can bring to me the website or the bottles or whatever it is that they're doing, and I can say that it's safe, I try to kind of end the conversation there. I firmly believe that people should be in charge of their own healthcare, and if they want to go ahead and do it anyway, that's up to them. But usually I will say, if it's a modality that I'm not quite sure of, I'll say I don't have a lot of information on that for you. I don't have experience with it, and I can't tell you definitively whether that's going to be a good idea. And that's what I can honestly say.
And where do you assess, where can you go to assess that? Like the NIH site with the supplements, do you find that reliable or?
Yeah, that's really tricky. I get asked that probably more than any other question, and I don't have a great deal of resources. And I think one of the problems is that most of the herbal safety resources that are out there are not written by practicing clinical herbalists. They're written through research studies that are fairly awful. So I don't have a great answer to that question. I wish I did. One of the reasons why I'm as involved in practitioner education as I am is to help arm providers with that knowledge moving forward, so that when it comes up in their practices, they know how to gauge that safety. But a lot of it is just provider training.
And my second question, I know you didn't want to address specific pharmacotherapy, but can you give me any information about low dose naltrexone?
I use it a lot. Uh, I use LDN a lot. I use it less so for Lyme disease these days because I have found that other things work better. The one place where I still use LDN a lot is for EDS, it's for Ehlers-Danlos, just because I have so many patients that can't take a lot of things because of MCAS, that LDN is one of the things that they usually tolerate okay. I have not personally seen LDN work that well for post-treatment Lyme disease. I'm actually now, when I'm choosing medications, shifting to things like hydroxychloroquine. I think that it works really well for a lot of different long-term inflammatory conditions. I haven't seen it work that well for post-treatment Lyme.
Question.
Hi. Oh, do you want to?
No, go ahead.
Thank you so much for that lecture. Honestly, that was the best lecture I've ever heard about the herbalistic approach. So, and I'm a pediatrician. No, and what I really love about the way you presented it to us is that you think about these in specific categories that are known to be associated with these syndromes. We don't fully understand them, just like you said, but I love how you think about these, and it's not a one size fits all. It's not a cocktail,
Right.
So just thank you so much. And I'll be
Thank you.
calling you. But anyway, what about pediatrics? Do you have dosages for pediatrics? Do you, when I talk next, 40% of our kids, the family's using something.
Yeah.
And I don't know how to advise them.
My father was a pediatrician, and I grew up surrounded by pediatricians and pediatric nurses. And so coming into medicine, pediatrics was always on the forefront of my brain. But now that I don't treat kids anymore, I've lost a lot of that. I have every single herbalist that I work with that trained me, that I have trained, gives these things to their kids. There is a book recommendation I can give you. Rosemary Gladstar, who's kind of our fairy godmother in the herbal world, wrote Herbal Remedies for Children, and the focus is on gentle, safe remedies for common childhood ailments. She doesn't talk about Lyme disease in that book, but it will give you an idea of safe places to start for kids, things that we can always recommend for kids without having to worry about side effects. But since I don't treat kids and I wouldn't for Lyme disease, just because of safety and care, I can't give any formal recommendations. Sorry.
Was there we have question there, doctor? Should be working for you.
Thank you. I also second that amazing presentation.
Thank you.
What about your thoughts on ashwagandha? Does it have a role in this treatment, and NAD therapy?
NAD therapy. Can you, NAD?
NAD, I'm seeing it at a lot of the infusion clinics. It's as a precursor for more energy to ATP.
Oh, yeah, I don't know about that. It's probably on TikTok. Oh, okay. All right. Don't have any experience with doing that personally. I am also, because I don't have access to a lot of things that, you know, my colleagues in ID do as far as infusion centers go, we're oftentimes starting with kind of really easy to access remedies first. I use ashwagandha. I use ashwagandha for anxiety. I will say ashwagandha, every so often you get the person whose anxiety gets worse on ashwagandha because of the way that it works with the adrenal gland. That's rare, but I am one of the people that happens to. So it does happen. Otherwise, I think that ashwagandha is a great option. It's also really accessible right now. Dosing can be tricky because it is so widely available that there's like 1,000 different ways to obtain dose and take ashwagandha that like the dosing can be tricky. That's what I run into. Everybody wants to take these like new fancy things and I'm old school and I'm just like, just take ashwagandha powder because I know how to dose it. I also use ashwagandha for hypothyroidism a lot, just separate side note.
Other questions for Laura and Edline? Any? Raise your hand. I think you'll be around during lunch, I hope.
I wanted to mention this. I forgot I was going to flag this. If you guys are interested in learning more about plants, the nonprofit that I'm involved with, Syracuse Herbal Study Group, our last plant walk of the season is next weekend. So if you're interested in some more info on that, you want to walk around, look at some plants with me. I do it with the residents at community in the parking lot. So doctors do this. You can come find me. I can give you some more information.
Laura and Edline, thank you very much.